Welcome to the U.S. Council for Athletes' Health webinar titled Athletics in the Era of COVID-19, Isolation and Quarantine Updates. My name is Dr. Jim Borchers. I'm the president and co-founder of the U.S. Council for Athletes' Health. The mission of the U.S. Council for Athletes' Health is to collaborate with every athletic organization to inspire and ensure athlete health and safety is a priority. Welcome to today's webinar. We hope you find this information not only interesting, but informative and providing you with solutions as we navigate athletics in the era of COVID-19. If at any time during your viewing of this webinar you have questions, please email those to info@usca.com. I think we all know when we think about COVID-19 and athletics, we're dealing with a raging global pandemic, and especially here in the United States. If we just for a minute take some time to reflect on where we've been and where we're at now. Back in May, we thought that the pandemic was improving, and it actually was. And as we thought about our return to sport, we started to see an increase in the numbers of cases, so that by the time we got to the end of July, early August, we were seeing increase in COVID-19 and giving us pause on the return to athletics. And most recently, throughout the months in November and December, we've seen significant increases in spikes in the numbers of cases, getting close to over 180,000 cases, new cases per day in the United States. So on the verge of having a vaccination apparent in mid-December, and with sports continuing in the United States, but with many sports contests being canceled, we need to keep ourselves aware of new things that are coming out that are impacting our ability to participate in sport with COVID-19. As we think about those issues that are coming forward, we have new information that we need to be able to interpret around COVID-19 and quarantine for COVID-19. The first thing we need to do is understand what the difference between isolation and quarantine is, because we've been getting a lot of questions and confusion around the difference between isolation and quarantine. So to be clear, isolation is a term that's used to separate people that are sick or that are COVID positive from people who are not sick. So if someone has a COVID positive test or has symptoms that are consistent with COVID-19, they need to be isolated. Quarantine, on the other hand, is a term that separates and restricts the movement of people who may have been exposed to COVID-19 to see if they become sick. So those would be high-risk contacts. So household contacts, people that have spent 15 minutes within a 24-hour period within 6 feet of an individual who is known to be COVID positive, have had direct physical contact, who have been caring for someone who's been diagnosed with COVID-19. These individuals may be asked to quarantine. They are not at that time sick, but they are asked to restrict their movement so that they can be monitored to make certain they don't become sick and become spreaders of COVID-19. When should you isolate? It's really important to know what isolation means, but when should you isolate? So if you think or know that you've had COVID-19 and you've had symptoms, you need to isolate. And you need to isolate for the following time periods: for at least 10 days since symptoms first appeared. And if you've been symptomatic, you must have at least 24 hours of no fever without taking any medication. And you must make certain that other symptoms of COVID-19 are improving and significantly improving before you come out of isolation. So the earliest that you could come out of isolation if you've had COVID-19 and had symptoms is 10 days. It is important to notice that with COVID-19, we know that there is a significant number of individuals that lose taste and smell, and we know that this can persist for weeks or months after recovery. And this, in and of itself, does not need to delay the end of isolation. What if you've tested positive for COVID-19 but have not had any symptoms? You've been asymptomatic. If you continue to have no symptoms on a daily basis throughout your isolation, after 10 days, you can break your isolation or leave isolation. And that 10 days starts on the date you had your positive test. So really the minimum amount of time that someone who's been COVID positive should be in isolation is 10 days. And that has not changed. That recommendation continues to be the recommendation from CDC and other health officials as the appropriate amount of time for someone who's COVID positive or has COVID-19 symptoms to isolate. Quarantine recommendations have recently changed, and we need to review these and then their impact on athletics. The CDC continues to recommend quarantine for 14 days to more completely reduce the risk of spread of COVID-19. So that recommendation has not changed. They do recognize that 14 days is still the time period that will mitigate the risk most significantly for COVID-19 for those that are asked to quarantine. But the CDC and new recommendations recognizes that any quarantine shorter than 14 days needs to balance the reduced burden against a small possibility of increased spread of the virus. And that reduced burden includes mental health, physical health, economic burden, and compliance with quarantine, getting individuals to actually remain in quarantine for the time period required. This is a slide that shows a graph and data that the CDC used to make decisions about reducing quarantine. So as we'll see in a minute, the CDC is recommending reduction in quarantine times for individuals that remain asymptomatic with and without testing. But if we look here at the data, we can see that as we get down to days 7, 8, 9, 10, and then continue out to day 14, there is some risk if we break quarantine at any of those times before day 14, but it becomes negligible at about day 10. And certainly if we look at around day 7, there's a significant reduction in risk from 10% if we do no testing to about 4% if we do testing. And this information was based on using a negative PCR or molecular test as our testing modality from days 1 through 14. It's also important to be able to look at this data to understand where these recommendations come from. That in no testing, if we look at the residual post-quarantine transmission risk, with and without diagnostic testing. If we do no testing, we can see that that risk at day 7 is about 10%. At day 10, it's about 1.4%. And at day 14, it's 0.1%. So you can see that with no testing, the risk of transmission decreases if we stay quarantined till day 14. But certainly there is a reduced risk once we get to day 10. And then considering what that burden is from staying in quarantine from days 10 to 14 to get that reduction in risk from 1.4% to 0.1%. We also know that if we look at using either PCR molecular testing or more rapid point of care antigen testing, the reduction in risk at day 7 goes from 10% down to either 4 or 5.5%. And on day 10 down to 0.3 or 1.1%, and then at day 14, really negligible to add testing. And so you can see where the addition of testing to ending quarantine can help reduce risk, especially around day 7. So the CDC recommends now the following alternative options to a 14-day quarantine. The recommendation states that quarantine can end after day 10 without testing and if no symptoms have been reported during daily monitoring. So it's really important to note here that there must be daily monitoring during quarantine to make certain that no symptoms have occurred. And that if that is the case, then quarantine can end after day 10. And we do recognize, as we just mentioned on those last 2 slides, that there is going to be an increased risk in transmission, but the residual post-quarantine transmission risk is estimated to be about 1% with an upper limit of about 10%. The CDC also recommends the following as an alternative to the 14-day quarantine, that when diagnostic testing resources are sufficient and available, then quarantine can end after day 7 if a diagnostic specimen tests negative and if no symptoms were reported during daily monitoring. So again, a need for daily monitoring of symptoms and then a negative test no earlier than results on day 7. Now, the specimen may be collected and tested within 48 hours before the time of planned quarantine discontinuation, which means day 5. But that is, for example, only if you anticipate testing delays. So the recommendation really is to test on day 7, unless, for example, you have delays in getting PCR testing results back. Then you could test on day 5 or 6 in order to make certain that someone could end their quarantine on day 7 if they've remained symptomatic. It is important to note that quarantine cannot be discontinued earlier than after day 7. So there must be at least 7 days of a quarantine. And as we just saw with this strategy, there is a post-quarantine transmission risk that's estimated to be about 5%, with an upper limit of about 12%. So 2 new alternatives to the 14-day quarantine option from the CDC. One involving ending quarantine without testing, one ending quarantine with testing. It's also important to notice that there are other caveats to ending quarantine before 14 days. The CDC does state that persons can discontinue quarantine at these time points only if these criteria are also met. There cannot be any clinical evidence of COVID-19 elicited by daily symptom monitoring during the entirety of quarantine up to the time at which quarantine is discontinued, so up until day 7 or up until day 10. But most importantly, daily symptom monitoring needs to continue through what would be quarantine day 14, so that if at any point during that 14-day period from when the person begins their quarantine, they would be able to re-isolate themselves if symptoms were to occur and get appropriate care and testing. So daily symptom monitoring becomes really important for these recommendations. It's also important to know that that persons need to be, as I just mentioned, adhering strictly through quarantine day 14 to non-pharmaceutical interventions. And these include all the behavior modifications that mitigate the risk of COVID-19, which includes correct and consistent mask use when appropriate, physical or social distancing, hand and cough hygiene, environmental cleaning and disinfection, avoiding large gatherings or crowds, and ensuring that there is adequate indoor ventilation to indoor settings. It's also important to know that testing for the purpose of earlier discontinuation of quarantine should be considered only if it will have no impact on community diagnostic testing. So we need to make certain that we're not using significant resources to test people out of quarantine if those resources are needed for individuals to be evaluated that are sick to make the diagnosis of COVID-19. And so making certain we understand our resources is going to be very important. And testing for persons seeking evaluation for infection, again, needs to be prioritized. So what are our recommendations for athletics when we consider these new recommendations for quarantine and when quarantine can end? We recommend that all athletes should have ongoing education regarding COVID-19 and the recommendations for limiting risk of infection and transmission. And as you know, USCAH offers a solution athletics health space, which provides e-learning modules to accomplish this. We also recommend that all athletes should have daily symptom monitoring to reduce the risk of infection and transmission. And again, by way of example, we'll share with you on Athletics Health Space our Game Day Ready survey, which is being used by thousands of individuals to track their daily symptoms and make certain that they are ready for competition. This is just an example of what one of the courses looks like for education in our Athletics Health Space site. But again, education is a key component along with making certain we monitor our symptoms. And so making certain that we have appropriate education for our constituents is important. And making certain that we have the ability to track compliance around daily symptom monitoring is also going to be important as we're able to think about how to remove people from quarantine prior to 14 days throughout this process. USCAH also recommends that all athletes should isolate for 10 days following a COVID diagnosis, whether they have a COVID positive test or have symptoms that lead to a positive COVID diagnosis. They should only leave isolation if they have been asymptomatic or symptoms have resolved, and that, again, that minimum period for isolation is still 10 days. There is no testing out of isolation. This is not an option. And then our recommendation around quarantine is as follows. All athletes should quarantine if identified as a high-risk contact for COVID-19. They should monitor their symptoms daily for a total of 14 days. If the athlete remains asymptomatic, they may leave quarantine on day 7 if they have a negative PCR test, and we are recommending that that test be collected no earlier than day 5, but could be collected on day 5, 6, or 7 to get results so that that individual would be able to leave quarantine on day 7. It's also reasonable to use an antigen test on an asymptomatic individual to make the determination to leave quarantine, but we recommend that that antigen test would be performed no earlier than day 7 of quarantine to allow that individual to make the determination whether or not they can leave quarantine at that time. If an athlete remains asymptomatic, they may leave quarantine on day 10, and there's no testing that's required, but again, they should, in both situations, continue to monitor their symptoms daily for a total of 14 days. Athletes should report symptoms and re-enter quarantine if symptoms occur, and that is extremely important. Many of these recommendations rely on athletes being able to report their symptoms accurately and being honest about their symptoms to reduce the risk of transmission spread. Again, we would reiterate at this point in time that we do know that the length of time in quarantine that mitigates risk the most is a total of 14 days. But given concerns around mental health, physical well-being, economic burden, and being able to function in society, we have provided you with our recommendations for athletes and their ability to compete as well, leaving quarantine earlier than 14 days based on the CDC's recommendations. At this point in time, we welcome your questions again to info@usca.com. We hope you found this information not only informative, but responsive to your needs as you think about returning athletes to play, and know that the U.S. Council for Athletes' Health is here to help you answer questions and provide solutions as you return your athletes to competition. Thank you.